Hello students, uh, good afternoon. Last class we discussed about the first part of the brachial plexus. Today we are going to discuss the remaining part of the brachial plexus, right? So let's review 2 minutes which we discussed last class, right? So the brachial plexus last class, what we discussed was the Robert, uh, Turner, drinks, cold, beer, right? So that was, we discussed the roots, the trunks, the divisions, chords, and the branches. The brachial plexus last class we discussed was the brachial plexus had the 5 root values C5, C6, C7, C8, and T1. As we have the formula here 1, 2, 3, 4, 5, it starts from 5, right? And it has the 5 roots values in the standard individuals, right? Some individual has the prefix if it goes above C5, somebody has the postfix if it goes below T1, that we discussed. And we discussed about the trunks. Let's see here, C5 and C6 combined form the superior trunk, the C7 single form the middle trunk, the C8 and T1 it forms the inferior trunk, that we discussed. After that the trunk goes to the divisions. Each trunk divides into anterior division, posterior division, anterior division, posterior division. Here we have the posterior division and the anterior division, right? So all of these posterior divisions combine together to form the posterior chord that we discussed last class. And then the upper 2 anterior divisions, they form the lateral chord. The lower one or inferior one, the anterior division, it forms the medial chord, right? And then these chords, they given the terminal branches over here. From the lateral chord we have one continuous one branch, that was the musculocutaneous nerve. And from the medial chord it was continue to form the ulnar nerve, right? And then from the posterior chord it was continue to form the radial nerve, and then it was giving one branch as an axillary nerve. And musculocutaneous nerve, that is from the lateral chord, the lateral chord was giving one branch like this, medial chord was giving one branch like this, and these two combinedly they were forming the median nerve, right? So this median nerve has 2 roots. One we have the lateral root, and then we have one the medial root, combinedly forming the median nerve. So those were the things we discussed. And we also discussed about the branches over here, right? So let's review these branches very quickly, and then we will discuss there the root values today, the root values, and then the muscle supplied by the brachial plexus, right? So the branches we discussed were like from the root we discussed here, we had one root going like this, right? And then from one root one branch was going like this. And from the these 3 roots we had one nerve coming like this, right, going down like this. And then from the superior trunk we had these 2 branches going like this. From the divisions we had no branches. And from the chords, the lateral chord, we had the 1 branch, right? And from the medial chord we had 1, 2, 3 branches. And from the posterior chord we have 1, 2, and 3 branches, right? That we had discussed last class. And what were those branches? This branch, I'm talking about this branch. This branch was, which branch was this one? The this branch was our dorsal scapular nerve, and this branch was long thoracic nerve, we said. And that was our suprascapular nerve, that was our the nerve to subclavius, right? And then this one we said the lateral pectoral nerve. And then here was our medial pectoral nerve, and we had all the branches here as MMM, right? So medial cutaneous nerve of arm, medial cutaneous nerve of forearm, that we discussed, yes. And then in the from this posterior chord we had the branches like this, was our upper subscapular nerve, and that was our lower subscapular nerve, that was our thoracodorsal nerve. That's what we discussed last class, yes. If we have discussed this last class, now today we are going to discuss about the root values. So let's start to discuss about the root values. Before going to root values, I want to give you one trick over here. That trick was, we use some trick to memorize the the branches. And that trick was from the lateral cord. The branches from the lateral cord was, we discussed like Lucy loves me. That was the branches from the lateral cord. So remember, Lucy loves me. And then we discussed about the branches from the medial cord. From the medial cord branches we discussed as in the medial cord we discussed as the mum, right? So like we said, M for U, 4 times M and then U. That was the branches from the medial cord. And from the posterior cord we have discussed, the posterior cord has the root values from all the spinal roots, all the roots of the brachial plexus. That's why we gave it as the ultra. This nerve was the posterior cord was ultra, so that we said it has the ultra branches, so that ULTRA, that was what we discussed. So we know the formula here. From the lateral cord we have the branches as Lucy loves me. From the medial cord we have the branches as M for U, and from the posterior cord we have the branches like ULTRA. That was what we discussed. So if you finish these branches from the cord and all the chords, now maybe you were thinking to get the the easy technique to memorize the branches from the roots and the trunks as well. So here I can give you one easy technique. Like you can use the formula as the, let's write over here, DSLR, right? So if you remember this as DSLR, from this DSLR you have the D for dorsal scapular nerve, and for the S you can use as the this one suprascapular nerve and nerve to subclavius, right? So this is for S. And L for, you can say, the long thoracic nerve, right? And then from the R you can say this is the branches from the root, but here two exceptions we made, that is S was the exception here. So R means the branches from the root, right? So as DSLR you can remember these branches from the root and the trunks, and then from this Lucy loves me, ultra, and then M for U, you can remember the branches from the chords, right? So if you remember this one, now let's remember their root values, right? So to remember the root values, we have the easy trick here. We can easily memorize the root values with some exceptions are there. So these exceptions also we will use a trick to memorize. So now let's see these root values. See, dorsal scapular nerve, it is coming from only one, right? So you can see like this. So this dorsal scapular nerve is coming from this way. So this should be what? This should be, let's use different colors. So this should be C5, right? This is the root value for my dorsal scapular nerve. And I have another branch here from the root, that is my what? This is my long thoracic nerve. Let's see. This nerve is coming from here, that is C5. It's coming from here, that is C6. It's coming from here, C7. So that the root value for my long thoracic nerve should be C5 to C7. So this is easy to remember, right? And then let's go to the another nerve. This nerve is the suprascapular nerve. See, the suprascapular nerve is going this way. It is coming here, so it is following this root and it is following this root. That means it is going through these two roots, right? So the branch to my superior scapular nerve is, that is C5 and C6, that is suprascapular nerve. This is which nerve? Suprascapular nerve. After that we have another nerve here, that is the nerve to subclavius. If this is my nerve to subclavius, let's follow it. It is going this way, and it is going this way, and this way, right? So that means it is following this root and this root. So this should be my again this C5 and C6, right? So that's it for the branches from the roots. Now roots and the trunks. Let's see the root values of the trunk. So this is my upper trunk. So the here let me highlight you. So this is my superior trunk or the upper trunk. The upper trunk is formed by this and this, right? So if it is formed by this and this root, the root value for this trunk should be this should be C5 and C6, right? Same. And then we have this is my medial the middle trunk. The middle trunk is going from the single root, so that should be my what? The C7. And let's see another one. This is my inferior trunk. My inferior trunk is going from this and this. That means my the C8 and T1, right? So this is the root values for the trunk. After that, the division, you can see this division is going this way, this division is going this way, right? This division is going this way. Finally, this division is forming what? The chords, right? The division follows the trunk. That's why these divisions has the same root values as their trunk, from which trunk it is originating. Let's go to the chords. For the formation of the chords, let's see. This chord is my lateral chord. This lateral chord has this division comes to C7, and this has this division follows C5 and C6. So this chord should have the root value here C7, here C5, here C6, right? So this is my what? C5 to C7. This is my lateral chord. And let's go to my posterior chord. This is my posterior chord. Posterior chord follows one this, so this one is following this C8 and T1. One root going from here, so it is following C7, and it is also connected by this, it is following C5 and C6. That means this is my posterior chord. My posterior chord contains this at C8 T1, this at C7, and this at C5 and C6. That's why this root value should be C5 to T1, all 5 roots of the brachial plexus. And then now let's go to the medial chord. So my medial chord is following this only, it's going continuously back. Let's see here, it is going here and it's going here. That means it's following the C8 and it's following the T1, right? So this is my medial chord. So this my medial chord follows the root values from C8 to T1, right? So we finish the root values for the chords as well, the trunks as well, right? So this can be the question, these can be the questions, right? So these all can be the questions in the exam. The root values for the lateral chord, the root value for the posterior chord, the root value for the medial chord. Now let's go to the root values for the branches, right? So for the branches here we follow some segmental innervations rule as well, right? So for that we will come back. Let's see first this branch, right? So this branch is coming from this, so it is containing the root values of how much? That is, this is containing the root value C5 to C7, right? So it's containing the root value from C5 to C7. Look, it's going like this, and this is coming from this trunk goes this way and this way. That means it's containing the root value how much? C5 to C7. So that's my what? Lateral pectoral nerve. So the lateral pectoral nerve, the root value is C5 to C7, right? So once we know this one, here we have some exceptions in this posterior chord branches. This we will come back. We will use the rule of the segmental innervation in this region. Okay, so now let's go to the root values for the medial chord. From the medial chord we have the branches. What are those branches? That is medial pectoral nerve. Let's follow this one. Medial pectoral nerve is coming from this way. That is what? C8 to T1. So that its value should be how much? C8 and T1, right? Now let's see the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Let's see, it's following these two roots, that is C8 and T1. There is one rule about the innervation of the upper limb. They said that the brachial plexus has the segmental innervation to the upper limb. That means the upper root supplies the the upper regions, the lower root supplies the lower regions. It is applicable for the muscles as well as for the skin. So let's see here. So medial cutaneous nerve of arm. Cutaneous means skin. Cutaneous means skin. So this is medial cutaneous nerve of arm, which is above the medial cutaneous nerve of forearm. So if we use the rule of the segmental innervation, this is arm means above, so that it is supplied by the upper root. That upper root means it is going from C8 and T1. Among these two, C8 is the upper root, right? So that it is supplied by C8. It supplies the medial aspect of our arm. And then another, this is the forearm. Forearm is the lower than or inferior than the arm. That's why if we use the rule of segmental innervation, the root value C8 T1, C8 is going to arm, then T1 should go to the forearm, right? So that these are the root values we can remember. Now the same rule we use over here as well in these three nerves, right? So these three nerves use the same segmental innervation. Let's see. Though they all originate from this C5 and T1, this C5 and T1 is divided among these root values, among these nerves branches, right? So upper subscapular nerve, this upper is upper, so it should be supplied by the upper root. That upper means C5 and C6, and this is lower, right? So this is lower subscapular nerve, but it is supplying the subscapular muscle. That's why both of these are supplying subscapular muscles. So we say they have the same root value, that is what, C5 and C6. And this thoracodorsal nerve, this is going to the latissimus dorsi. Latissimus dorsi is lower than subscapular nerve. That's why it is supplied by the lower segments, right? So the lower segments means that is C6 and C8, C6 to C8, right? So that let's make this the root values. So upper subscapular nerve, though it is coming from C5 to T1, it is upper. That's why we use the segmental innervation trick. So it is supplied by C5 and C6. It is similar to this one, that is C5 and C6, because this is subscapular nerve, this is also subscapular nerve going to the same muscle, right? And thoracodorsal nerve, which is lower than the subscapular nerve, so it is supplied by the lower segment. That is what we use this C6 to C8, right? C6 to C8. This is the trick for this. So for this region, please use a trick to memorize the root values, right? So we finished these root values. Now let's go to the root values for the terminal branches, right? So let's see the terminal branches. That's my musculocutaneous nerve. So this my musculocutaneous nerve is following this one. If it is following this one, it contains first the root here, that is C5 to C7. So my root value for the musculocutaneous nerve should be C5 to C7, right? So the root value for this one is C, for the musculocutaneous, C5 to C7. This is my musculocutaneous nerve, right? Now let's go to the median nerve. Let's leave the axillary nerve for a while. Median nerve. So median nerve contains the root value from here, that is what, C8 to T1, and it is also coming from here. So this is the root value C5 to C7. So median nerve contains the root value of this one, C5 to C7 here, and then C8 to T1 here. That means this is the question they can ask you. The medial root of median nerve root value C8 T1. The lateral root of the median nerve root value C5 to C7. So if you combine this and this, it becomes the root value, that is C5 to T1. That means all 5 segments, all 5 roots, they supplies the median nerve, they forms the median nerve. So from here they will ask you the question, this one they can make you the question, this one they can make you the question, this one they can make you the questions, right? So these are the questions in the exam. Let's go to the radial nerve. In the radial nerve, the radial nerve is coming like this. So this radial nerve is going through this one, right? So if it is going through this one, what are the root values of this one? It contains the root value, that is what, C5 to T1. So that radial nerve also contains the root values, that is C5 to T1. This is my radial nerve. Now I go to the next nerve, that is my ulnar nerve. So ulnar nerve is coming like this. So if it follows this way, where it comes to C8 to T1. So my ulnar nerve root value is which one? C8 to T1. Here some confusion may arise. The ulnar nerve supplies, we will discuss about the muscle supply. Ulnar nerve also supply the flexor carpi ulnaris muscle. The ulnar nerve which is going to flexor carpi ulnaris, it contains the root value C7, C8 and T1. So that this is the exception here that we should memorize. Okay, so the root value for ulnar nerve is C8 to T1, that is C8 in T1, but the ulnar nerve which is supplying the branch of ulnar nerve which is supplying the FCU flexor carpi ulnaris, it also contains the root value C7. That's why it becomes C7, C8 in T1. So that you may find somewhere they will write like the ulnar nerve root value C7, C8, T1, but that's not true. Only the nerve which is going to flexor carpi ulnaris, it contains the root value C7, right? So only one left here, that is what? Axillary nerve. So axillary nerve is also the exception, like we have discussed over here, right? So what we have discussed over here is that we discuss about the segmental innervation, right? So use this segmental innervation rule for the posterior cord and then the axillary nerve, because this is also the branch of axillary the posterior cord, right? So this axillary nerve supplies our deltoid muscle, which is the superior muscle. So the root value which is coming for this axillary nerve is also coming from the upper root, right? So that should be C5 and C6. So we can remember this way. So these are the root values we discussed right now. We finish all the root values. After this we will go to discuss about the muscle supplied by these nerves, right? So that's easy. Let's see. So before going to that, I want to add some points over here in the branches, right? In some places, in some books, you may find the branches of the brachial plexus as they have added one branch over here and one branch over here. So this branch is the contribution to the phrenic nerve. This branch is the continuous contribution to the phrenic nerve. Phrenic nerve contains the root value this, and this. That means it contains C5, C4, right? And then it also contains the C3. So C3, C4 and C5, it forms the phrenic nerve. So this phrenic nerve is not the true branch of the brachial plexus, but it is the contribution from the brachial plexus. So this is my which nerve? The phrenic nerve. And let's go to the next branch I have drawn over here. This branch is my first intercostal nerve. So this first intercostal nerve is also coming from us T1, and this is going to the intercostal muscle, first intercostal space, and this is my phrenic nerve. This phrenic nerve is going to my diaphragm. Phrenic nerve is going to my diaphragm. So hope you are clear about the root values of these nerves, right? If you clear of the root values of the nerves, now let's go to the muscles supplied by these nerves. Okay, let's go forward. Now let's see this muscle. These are the muscles of our upper limb. So if these are the muscles of our upper limb, let's make a general concept over here. That concept is this region muscles. This region muscles means these are my what? Clavicle plus scapula, right? So these are supplied by the branch from the root, the branch from the trunk, and pre-terminal branches of cords. Is that okay? Clear? So clavicle and scapula muscles, they're supplied by the branch from the root, branch from the trunk, and the pre-terminal branches of the cords, right? After this, let's go to this. This is my arm, this is my forearm, and these are my phalanges. So this is my arm, this is my forearm, and these are my hand. Let's say the hands, right? The hand muscle. So let's see. In the first, these regions, the arm, forearm, and then the hand, all of these we divide into two groups. Let's see. All of these we divide into two groups. One is flexor compartment and another one is extensor compartment. And in the hand we say these are the intrinsic muscles. Intrinsic muscles. So let's see this one. The flexor compartments, these are my extensors. Okay, so let's see the flexor compartments. In my flexor compartments, the flexor compartment I divide into further arm flexor and the forearm flexor groups, right? Extensors common, right? And intrinsic muscles will divide into different groups, like the thinners. Thinners means base of the thumb, right, towards the thumb, that is thinners. And we have the hypo thinners, that means towards the small finger, that is my hypothinners. Another one, in the palm we have three group of muscles, that is palmar interosseous, next one is dorsal interosseous, next one is lumbricals, right? So we divide this way. So if we have to think this way, then with some exceptions, let's make a general rule for here. That general rule is okay, let's make by this one. The flexors of the arm, these are supplied by musculocutaneous nerve. The flexors of the forearm, these are supplied by median nerve, with some exceptions are here. We will discuss that exceptions. Okay, and the extensors, all the extensors are supplied by radial nerve, right? And all these intrinsic muscles, they are supplied by ulnar nerve. Is that okay, right? So these are the general rules we need to memorize. That is arm flexors of the arm. Flexors means front. Flexors means front of your hand. These are the flexors. And extensors means they are the back of your hands, right? So the flexors, they are supplied in the arm, supplied by musculocutaneous nerve. In the forearm, supplied by the median nerve, with there are some exceptions we will discuss. And the extensors, all the extensors, back side of your hand, that is that means arm, forearm, everything is supplied by radial nerve. And all the intrinsic muscles of the hand, intrinsic muscles means all the muscles present in your hand, in the hand. Remember, hand means below the wrist. Okay, hand means below the wrist. So these are all supplied by what? Ulnar nerve. So this is the general rule we made. Now let's go to discuss individually which nerve supplies which muscle. So if you remember these nerves name, then let's go from the nerves from the root, right? So if you write here, it looks dirty, so that if you know the root values and then the branches here, let me rough this one. After clearing this all, I will insert the root and then the muscles here. So first branch was this one. That branch was dorsal scapular nerve. So this dorsal scapular nerve is going dorsal to our scapula. So this is supplying my rhomboidus muscle, that is rhomboidus major and minor, plus it is supplying my levator scapulae muscle, right? So this is the dorsal scapular nerve. After that, I have another branch here. If you remember, that was our branch, right? So this branch was coming like this, one from here, one from here, one from here. So this is my what? Long thoracic nerve. This long thoracic nerve is supplying my muscle serratus anterior muscle. This is supplying serratus anterior muscle. Now let's go to the next branch here. That was my suprascapular nerve. And this my suprascapular nerve is going to the scapula through the suprascapular nodes, and it is supplying my supraspinatus plus infraspinatus muscle. Okay, it is going to backside of our scapula, and backside of our scapula in the dorsal surface we have two muscles, that is supraspinatus and infraspinatus. So the supraspinatus and infraspinatus are supplied by my suprascapular nerve. After that, I have here the nerve to subclavius. This nerve to subclavius is going to my subclavius muscle. Which muscle? Subclavius muscle. So subclavius muscle is present below the clavicle, in this subclavius groove. So you have to remember the muscle attachment in the bone. In the next lecture we will make the muscle attachment as well. So these are the branches from the root and their muscle supplied. We finished. Now let's go to the branches from the lateral cord. In the branches from the lateral cord, we have one branch here that was what? The lateral pectoral nerve. So my lateral pectoral nerve is here. This lateral pectoral nerve is supplying my two muscles. So this is supplying the pectoralis major and the pectoralis minor. Pectoralis major and pectoralis minor. That's my lateral pectoral nerve. And I have the medial pectoral nerve here. If you remember, this is my medial pectoral nerve, right? So this is my medial pectoral nerve. It's supplying my medial pectoral nerve is supplying my pectoralis minor, right? Pectoralis minor. So these are the branches. Now let's go to the other branches from the posterior cord, right? So this is my posterior cord. The posterior cord has the three branches we discussed. That was our one branch. So this one branch was what? This branch was our upper subscapular nerve, right? So if it is my upper subscapular nerve, it is supplying my what? Subscapular muscle. Subscapular muscle is present in the subscapular fossa. And we had here another nerve, right? That was our lower subscapular nerve. So lower subscapular nerve is supplying two muscles. That is my subscapular muscle plus teres major muscle. Okay, teres major. Both of these are the muscles of the scapula. Teres major is in the lateral border of the scapula. Subscapular muscle is in the subscapular fossa. And we have another branch here. That branch is what? This branch was thoracodorsal nerve. This thoracodorsal nerve, it is supplying my latissimus dorsi muscle. Latissimus dorsi muscle. Okay, so we finished these branches, and here that we don't need to discuss much, that we know already, right? So this was our what was that? The medial cutaneous nerve of the arm, and then the medial cutaneous nerve of the forearm. They were going to the medial surface of our arm and forearm, the skin. They were supplying the skins, right? So these are the muscles supplied by these branches. Now for the muscle supplied by this the terminal branches, we will see backside. Okay, because they have little bigger list. We have to prepare the list for this. So we will see from musculocutaneous nerve to axillary nerve, median nerve, radial nerve, and ulnar nerve separately, right? So this was the general formula we prepared over here. Now let's see. So what are the branches we said? Let's start from the musculo, or if you need, here we can draw the very quick picture as well, right? So one was like this, another was like this, and another was like this, right? So here we can just make it, sorry, this is okay, you can just make it one root over here. We can make one root over here, and this one we can mark as C5, C6, that is C7, that is a C8, and that is at T1. So this is how we can make it, and we can consider this as my terminal branches. So if this is my musculocutaneous nerve, what is this? My musculocutaneous nerve. If it is my musculocutaneous nerve is supplying my BBC. So it was supplying where? It was supplying the flexors of arm. It was supplying my flexor of arm. So this flexor arm we say BBC. That means that is one is brachialis, another one is biceps brachii, and another one is coracobrachialis. So we can make this formula as BBC. So the musculocutaneous nerve supplies BBC. Now we have some exception here, some exception, or we can say some informations this one, that is our brachialis muscle, right? So this brachialis muscle is a hybrid muscle. Hybrid muscle means the muscle which has the dual nerve supply, right? So brachialis is supplied by musculocutaneous nerve, plus it is also supplied by the radial nerve. So this is the exception here. Please memorize for the exam. So this can be the question in your exam. So this is my musculocutaneous nerve. After this, so from here, as I continue, I have the radial nerve, right? So which nerve do I have here? That's my radial nerve. So let's make it radial nerve. And this radial nerve, as we said, it is supplying all the extensor compartment muscles. It is supplying the extensors. So we can make the formula for this, the radial nerve, as the BEST, right? So what does BEST mean? Let's make it the BEST. So B for same as brachialis we have there, right? And then E for all the extensors, right? Extensors of the arm, sorry, forearm, we can say, right? So all the extensors we can say. And S for supinator, supinator. So here in the supinator, you can remember as the all the supinator muscles as supinator plus anconeus as well, because other muscles has the flexors in extensors in the name, we will remember easily, but anconeus has no extensor name by the name. That's why we may forget this, right? So T for triceps, right? So if we can remember like this, that's easy for the radial nerve. And the exception is that we discussed already, brachialis, right? So this brachialis has the dual nerve supply as it is a hybrid muscle. So we said already it is supplied by what? Musculocutaneous nerve as well as radial nerve. So that's what we did. Now after this, let's go to the another branch here from the medial cord. That was my what? Ulnar nerve, right? So this is my ulnar nerve. So this is my ulnar nerve. So this ulnar nerve, we discussed, ulnar nerve is also called the musician nerve. Musician nerve. So see, the people play the music through the hand, right? So hand, the palm, the fingers, yes or no? That's why this nerve supplies all the intrinsic muscles. Ulnar nerve supplied all the intrinsic muscles of hand, right? With some exceptions are here. Exceptions are here, right? That exceptions we will mention now. These exceptions, and plus it supplies it supplies the, this is our ulnar nerve, right? So plus it supplies the 1.5 muscle of my forearm flexor, right? So we will make a list over here now. So the ulnar nerve, so ulnar nerve is supplying all the intrinsic muscles. We said all the intrinsic muscles, right? So if you say all the intrinsic muscles, so what are those intrinsic muscles? Let's list these intrinsic muscles. So let's make it like this. So that is my intrinsic muscle. Intrinsic muscles are the thinner muscles, THENAR, thinner muscles. We have 4. Similarly, we have hypothinner muscles, that is we have 4. And we have the lumbricals, LUMBRICALS, lumbricals. Lumbricals we have 4. And we have the dorsal interosseous, that is we have 4. And we have the palmar interosseous, that is we have 3, right? So now see, so the ulnar nerve supplies all the intrinsic muscles. That means it supplies all the intrinsic muscles, that is palmar interosseous, yes. All the dorsal interosseous, yes. All the hypothiners, yes, right? But in the thinner eminence, out of these 4, we make 3 plus 1. 3 plus 1, right? So these 3 supplied by median nerve. Okay, so this one only supplied by ulnar nerve. So let's remember this one. And the lumbricals, we say these lumbricals 4. 2 lumbricals laterally, 2 lumbricals medially. That is lateral, that is medial, right? So these 2 lateral lumbricals, this is supplied by median nerve, and we have these 2 medial lumbricals that is supplied by median nerve. Is that okay, right? So if we understand this much, we said, so see, so all the muscles in the hand, intrinsic muscles, they are supplied by ulnar nerve, except 3 muscles in the thinner eminence, we will remember the name, and then 2 lateral lumbricals. Others all are supplied by what? The ulnar nerve. Plus in the forearm, ulnar nerve, we said forearm, it supplies 1.5 muscle. That 1.5 muscle is, one is FDP, medial half, right, plus FCU. So this is supplied by what? Flexor carpi ulnaris, that is supplied by what? The ulnar nerve. Is that okay? So these are the muscles supplied by ulnar nerve, the radial nerve, and musculocutaneous nerve. Now 2 nerve remain here. That is my median nerve, and the another one is what? The axillary nerve. So let's see the axillary nerve. We had the axillary nerve over here. That was our axillary nerve, right? So axillary nerve, the root value, if you remember, we said that is 5 and 6. C5 and C6, that's my axillary nerve, right? So this axillary nerve with the root value C5 and C6, right? So see, we said one rule, that is the segmental innervation. So segmental innervation means upper root supplies the upper muscles or the upper skin. So if it has the root value C5 and C6, it should supply the upper muscle. These upper muscles are, it supplies the 2 muscle, that is my teres minor, plus it supplies the deltoid muscle. Is that okay? So we finish all the muscles supplied by the terminal branches except for the median nerve. So median nerve, we don't have the space over here. We will make the median nerve in the another page here. Okay, so let's make the median nerve over here. We can see the muscles over here. This is, we are looking from the back side, and this is, we are looking from the front side. Okay, so we will come to these muscles again. So let's complete the median nerve here now. So we have the median nerve. So for the median nerve, let's draw this as like we draw over there. So this is one, and the one was another one, right? So there will be C5, C6, C7, C8, and T1. Yes, after this one, so we were forming the median nerve over here. That median nerve, let's draw this way. Okay, so finally it was forming the median nerve like this, right? So that was my median nerve. So median nerve, what we said in our general rule for the median nerve, let's see the general rule. What we said for the median nerve. Median nerve, where is our median nerve? Radial nerve is here, median nerve is here, right? So the median nerve, we said all the muscles in the forearm plus some exception we have said over here. Yes or no? So let's go to the median nerve. So median nerve supplies, let's make it median nerve, right? So the median nerve supplies what? It supplies the flexors of forearm, with some exception is here, of course, right? Plus 3 thinner muscles plus 2 lumbricals, right? So let's make the median nerve supply. So yeah, we finished this now. Yeah, I wrote over here. So median nerve supplies what? All flexors of forearm, exception, if you remember, median nerve was supplying the FDP, right? So FDP, so FDP has 4 tendons, right? Medial side and lateral side, 2 lateral, 2 medial. So this medial supplied by ulnar nerve, 2 lateral that is supplied by median nerve. So this is FDP. Another one is what? Another exception is that FCU, flexor carpi ulnaris, that is supplied by what? that is supplied by ulnar nerve, just now we discussed. So this is the nerve supplied, muscle supplied by the median nerve in the forearm, right? And it also supplied with it, we said, 3 muscles in the thinner eminence. So 3 thinner muscles. So thinner muscles, what are those 3 thinner muscles? We have the thinner muscles as 4, we said, right? So what are those 4 thinner muscles? We have as adductor pollicis brevis, we have the flexor pollicis brevis, we have the opponens pollicis, we have the abductor pollicis brevis, right? Among these four, adductor pollicis brevis, that is supplied by ulnar nerve. Remaining these 3 are supplied by median nerve. So you can remember easily like all the intrinsic muscles. So you can make a general rule: all intrinsic by ulnar nerve with some exception, that is 3 what is this one, thinner muscles, and all 4 arm plexors, that is by median nerve with some exception, that is FTP and FCU, right? So we finish this one. So it supplies the three thinner muscles, plus it supplies the 2 lumbricals, 2 lateral lumbricals, right? So lumbricals we have 4, 2 lateral, 2 medial. So 2 lateral lumbricals are supplied by what? The median nerve. Is that okay? So we finished all the muscles supplied by the branches of the brachial plexus. And here I want to add one more point in this, like flexor pollicis brevis. It is supplied by median nerve, but flexor pollicis brevis has 2 head, 1 superficial head, 1 deep head. This deep head is supplied by the ulnar nerve, superficial head is supplied by the median nerve. So please remember this exception as a question in the exam, right? So we finish all the muscles supplied by the branches of the brachial plexus. So you can see the muscles over here, right? So we have shown the muscles here. These are the posterior compartment muscles, these are the anterior compartment muscles, and this is our deltoid, right? So we can see the scapula over here, right? So this one we can see the anterior view of the muscles in our scapula, the arm, and some muscles over here in the forearm, right? So we can see like this. So this is our brachialis, which were supplied by 2 nerves we just discussed, yes or no? And this is the exceptions also we made it right now. And yes, if you were looking for the flexor digitorum profundus FTP, which has the dual nerve supplies, as we said, yes or no, right? And flexor carpi ulnaris, where is this one? Flexor carpi ulnaris, right? So all the flexors were supplied by here median nerve, and that was the exception, that was supplied by ulnar nerve, right? So that was supplied by ulnar plus median both. So that's what we discussed. And see the lumbricals and thinners and hypotheners muscles we can see here, right? So the thinner eminence, the muscles given over here, right? So this thinner eminence, you can see here muscles, yes, 1 2 3 4 muscles you can see here. So it has the 2 heads, oblique head, and then the lateral head of our adductor muscle over here. And then we have the opponents, we have the flexors, and we have the abductors over here arranged this way. So among these, all these 3 we have said there, right? So we have said there, except the adductor here. This is adductor is, if you compare from this side, it is easy to remember. So if you compare from this side, these are lateral side, this is medial side. So medial side we have the ulnar nerve here, that's why this is supplied by ulnar nerve, and these are supplied by median nerve, that we said, right? So this is the differences we said. And we can see here the interosseous muscles, the dorsal and then the palmar interosseous muscles, that's what we discussed. And we said the lumbricals, and see here one point, the lumbricals are those muscles which are worm like, and all they originate from the tendon of FDP. Okay, so you can see like this one, this is important, right? So this is the branches, and then the muscle supplied by the branches, which is discussed. Now let's go to the course of the brachial plexus. In the course of the brachial plexus, it's very easy to remember. Look at here, in the neck we have three muscles. This is my anterior scalene, middle scalene, posterior scalene, right? Anterior and middle scalene, they are coming from the first rib, that is my what? Anterior and middle scalene muscle. Okay, and this is my posterior scalene muscle, which is coming from my second rib. So second rib is my posterior scalene muscle. Is that okay? If we know this one, now see these three muscles, they are forming the two triangles over here. One triangle is this one and another triangle is this one. Okay, so remember, this is anterior scalene triangle, this is anterior scalene triangle, this is posterior scalene triangle. So let's remember the point. All the roots and the trunks of the brachial plexus are present in the anterior scalene triangle, right? Posterior scalene triangle, backside, it contains only one nerve. That nerve is the long thoracic nerve. So remember this for the question, right? So we see here the two triangles. One triangle is what? One triangle is what? The anterior scalene triangle. This anterior scalene triangle contains what? The roots and the trunks. Okay, this is the course, and roots and trunks, and it also contains the subclavian artery. Okay, and the another one we have here is the posterior scalene. That is my next triangle, that is posterior scalene triangle. This posterior scalene triangle, it contains only one nerve. That is which nerve we said? That is long thoracic nerve, just we said, right? And this is about the course of the brachial plexus, in which the root and trunk is present within the neck, that is anterior scalene triangle, right? Now after the root and trunk, it forms the divisions. The divisions comes below the clavicle. After that, it forms the cord. The cord comes below the pectoralis minor muscle. This is my pectoralis minor muscle. So the cord comes below the pectoralis minor muscle, and the cord has very good relationship with the second part of axillary artery. So you can see here the second part of axillary artery. So these cords we discussed, like the lateral cord, the medial cord, the posterior cord. These cords are classified according to the position of what? And the position of our the second part of axillary artery. This is a question in the exam. Second part of axillary artery. Okay, and then distal to the lateral border of my pectoralis minor muscle, you can see here. So these are my terminal branches. So this is the course of my brachial plexus, right? So we finish the from in these two lectures, we just finish what? The roots of the brachial plexus, the formation of the brachial plexus, the muscle supplied by the brachial plexus, like this, right? So we discussed all these, the muscle supplied, the roots, the branches, and then finally here we discuss about the course of the brachial plexus in this slide, right? So thank you very much. Hope you understand. If you have any queries, please comment. Thank you.